Hello, it is nice being here today again on you and your mental health. Hope everything is fine with you over there, wherever you may be listening to this. We've been talking about depression for a few days now and the causes and how it affects all genders. I don't want to move forward without talking about the relationship between depression and suicide. According to research, we're told that suicide rates have been falling globally, but rising in the United States. And since the turn of the millennium, and now stand at 14.2% deaths per 100,000 population. And since 1999, the suicide rate has risen to 35%. And since 2006, the rate of increase in suicide deaths has been accelerating. So the U.S. National Center for Health Statistics report that for female, suicide is most likely to occur between age 45 and 64. And among males, the peak age is 75 and above. So for both men and women, the rate of suicide significantly higher in rural area than in urban ones, according to Psychology Today. Right? I want to let you know also that most suicides are linked to some form of psychiatric illness, particularly depression. And the more severe the depression, the greater the risk. Still, most people with major depression do not die by their own hand. Studies have shown that about 5% of depressed persons may have thought about suicide, that is, suicide ideation. Only a small percentage of them actively make plans to end their life. And so it is important for us to understand that people who struggles with depression sometimes have suicide ideation. And I want to tell you that among those who are hospitalized for the treatment of depression, the rate of death by suicide is twice as high, that is 4%. And of course, 2% of people ever treated for depression in an outpatient setting take their own life. All right? So among people who kill, themselves, most times have mood disorder, which probably not treated. And of course, the rate of younger persons who, commit suicide due to substance use are higher than those who don't take substances. So what we are saying today is that when you see people struggling with depression around you, there is tendency to have had a thought of suicide one time or the other. So we need to watch out for them. And when this happens, then it means there's a need for us to take a drastic step about it and to watch out all the time for this kind of thing we're talking about. And I want to tell you today also that there's a place of emotional pain in the life of an individual. And when this emotional pain is becoming unbearable, there is tendency for endless negative thoughts. And of course, they want to escape this pain. And as a result of that, most time people have the thought of committing suicide because they want to numb their pain. They want to get away from their pain. They want to be freed from what they are going through. This is important. And I want to say also, just as depression can run in families, so can suicide also run in the family. Depressed people with a family member who died by suicide are themselves at elevated risk for taking their own life. People who have PTSD as well as depression are at risk of suicide ideation and suicide attempt. People who have history of trauma also raises the risk of suicide among those who suffer depression. Substance use by itself is a major risk factor for suicide, and when it accompanies depression, it had a risk of taking one's life. So this is important. These are the basic things that we need to know. Also, rejection and loneliness are significant contributing factor to depression, and people who are socially isolated are the higher risk of suicide than those who are not. So, because the brain makes no distinction between physical and psychological pain, people who have chronic pain along with depression or any chronic illness are at elevated risk of suicide. So, most of those who complete suicide are men, but women are 4 times more likely than men to make a suicide attempt. So, when we see people like this in our environment, what we need to do is to see how we can be of help to them. What we need to do as family is to set our eyes on them, to monitor them. But don't forget, before people have the thought of ending it all, there must have been a feeling of depression in place. And that is what I have in mind to share with you briefly today, that there is a higher level of relationship between suicide and depression. So when you have people like this around you, it is time to seek help. It is time to help them. I hope you're enjoying today's episode of You and Your Mental Health. Until I come your way again, keep yourself safe. Without mental health, there is no health. Have a nice day.